Hi all, here is the final portion of the inflammation and depression, slide section, um, or lecture, whatever you want to call it. So this is kind of mostly a summary of everything we've learned, just a few fun new details, some evidence for all of this. So first, let's talk about specifically the microglial cells' roles in depression. So we learned about what microglial cells do, and how they're super important in protecting the central nervous system, and how they're the first responders of the immune response for the central nervous system. But what is their role in depression? So what we found is that pathological stress or peripheral inflammation can activate the central nervous system resident microglia. So pretty much what that means is if you are stressed all the time, so other risk factors for depression, for instance, some peripheral inflammation, so some type of comorbidity, some type of other illness. This can activate the microglia to increase their secretion of cytokines. And so, as we know, the cytokines are what can go on to interact with other parts of the brain, and can cause other symptoms of depression. So, the microglial overreaction can also result in excessive synaptic pruning. In other words, the glial cells will release cytokines to go around and cause neuronal apoptosis. So it'll kind of overreact and go around saying, oh, you don't need these cells anymore, and remove cells in different parts of the brain. And again, that's where we'll then later on see a decrease in brain volume in certain areas of the brain in patients with long-term depression. Also, by having an overexpression of glial cells, we see decreased neurogenesis, which means we can't replace any cells that may have been accidentally triggered to die. So it prevents us from getting better. And so this collective effect may contribute to cell death and results in those behavioral and cognitive changes and dysfunction that we see in patients with depression. Now, the possible good thing is that antidepressants do seem to have some sort of anti-inflammatory effect. So the antidepressants, even though their role, especially SSRIs, their role is to decrease the amount of monoamine transporters, so they're making sure that there's more serotonin or epinephrine in the cells at all times. They actually have an effect on the glial cells as well. So good news is that antidepressants, they don't just have an effect on those transporters, but they have a more broad effect on other causes of depression. So antidepressants will actually decrease TNF alpha and AL6 levels in an animal model after LPS administration. So remember, those are drugs that are given to boost the immune system. They increase the inflammatory effect. So antidepressants will actually battle these other drugs that, again, are supposedly acting on a different part of the body. So it's pretty interesting. That's what the graphs on the side show. If you want to look at them more, they're, again, pretty interesting, or not. So again, So what happens if we give anti-inflammatory treatments? Will that have an effect on depression as well? So anti-inflammatory treatments in medical comorbidities of depression do also show antidepressant effects. So rather than treating the depression itself, if we go to treat the inflammation, we still see lower depression scores in those patients. So, such as an anti-TNF alpha treatment. So pretty much the anti-drug of the drug we were giving. Also, anti-inflammatory treatments for arthritis significantly improves mood symptoms. So arthritis, one of the symptoms is a lot of inflammation, which can cause a lot of pain, which can obviously, if you're constantly in pain, could definitely lead to depression. So we see a large comorbidity there. But with these anti-inflammatory treatments, we don't just see a change physically, but also on the mood. And then if we look at some retrospective studies, then we actually see that depressed patients that were administering acetylsalicylic acid or aspirin had higher rates of remission. So again, what aspirin does is it reduces inflammation. So even just aspirin has a little bit of an antidepressant effect. And especially when you take it over long periods of time. And bipolar patients taking aspirin also had a decreased incidence of medication changes. In other words, it had some sort of effect that they didn't develop tolerances as much to their antidepressant medications as quickly. So clinical trials have demonstrated the efficacy of celecoxib and minocycline, which both of them have anti-inflammatory effects, and they've said that they're just as effective adjunct therapies with antidepressant therapy. So, pretty cool that if someone, say, isn't responding to normal antidepressant drugs, you could try giving them anti-inflammatory drugs instead, and perhaps they'll have more of a response to that. So, of course, there are obviously some limitations to this. We have some clinical observations as well, so they have been trying this in a clinical setting. So curcumin, a plant phenol isolated from turmeric, which is an anti-inflammatory, is used in complementary medicine. So in other words, you probably heard that turmeric has some great medicinal effects, such as anti-inflammatory. So how does that work? And they did see that it does have some anti-inflammatory and antioxidant effects in Alzheimer's, Parkinson's disease, and cardiovascular disease. And preclinical work does show decreased cytokines, a more stabilized HPA axis activity, and improved mood behaviors in the animal model. So there is some clinical evidence that this phenol isolate from turmeric not only can be used as an anti-inflammatory, but perhaps as a mood stabilizer as well, at least in animal models. And then omega-3s, fatty acids, definitely heard of those, I'm sure, with especially fishy. They're popular in fish. Those also have some anti-inflammatory effects by competing with COX enzymes. And again, you'll see that there's been some clinical work with antidepressants in animal models. So just by increasing the amount of omega-3 fatty acids, you see improved mood in these animal models. And population studies show that high rates of consumption actually correlate with low rates of depression. So in countries that have a higher omega-3 amount in their natural diet, such as Japan or other Asian countries where they eat a lot of seafood. We also see a low rate of depression in those countries. So perhaps there is something going on there. Now, obviously, our limitations. So, well, we have some connections between inflammation and depression. You don't see inflammation in all depressed patients. So some patients actually will have decreased cytokines rather than an increase in cytokines. So something, again, could be going on there. And then monoamine oxidase inhibitors are poor anti-inflammatories. So MAOIs, not as great at decreasing the cytokine levels. However, some MAOIs, then you do see some change. So some studies do show an increase in cytokine release with phenelzine treatment. And then another big problem of the inflammation hypothesis is that most of this work has been done on animal models. So again, while it's a great starting off point, we really have to work on the generalizability of these findings to include humans. And then microgliosis as a state marker for suicidality. So pretty much in both schizophrenia and depression, microgliosis is observed in suicides. So particularly in regions involved in mood, such as the prefrontal cortex, the anterior cingulate, and the hippocampus, that's where we'll see more of this microgliosis. And obviously causality is very difficult to determine. Whether acute central nervous system inflammation may contribute to the neurobiology of suicide or not, and whether acute microgliosis may be a state marker for suicidality. So that is a big thing that researchers are starting to look at more, and it's a big question going forward with whether or not we attempt to treat depression with anti-inflammatory drugs or treatments, whether or not that will help with the suicidality and other symptoms of depression. So in summary, inflammation is observed in several psychiatric diseases. Here we're talking about depression. We'll talk about it again in schizophrenia and autism later. Animal models of inflammatory activation can be replicated a lot, so that's great. So here we talked about sterile inflammation, schizophrenia and autism. We'll talk about the maternal immune activation. And then conventional psychopharmaceuticals have underexplored anti-inflammatory effects. So going forward, that may be something to look at. So some antidepressants do have an effect on an anti-inflammatory scale. Obviously, going forward, we want to talk about antipsychotics as well, especially in terms of schizophrenia. And then anti-inflammatory drugs themselves actually have some sort of adjunct therapy in altering mood as well. So that's it for inflammation and depression. Here's some further resources if you're interested. It's definitely an interesting field of depression. So that is it for today. And the rest of the notes will be posted on Friday, even though, remember, the class on Friday will be live, but there will be videos for you to watch later.